When struggling to overcome chronic and disordered states of anxiety, acceptance-based strategies are superior to control and management-based strategies. But don't take my word for it. A large number of your peers seem to agree. So we're going to talk about that this week on The Anxious Truth. Hello, everybody. Welcome back to The Anxious Truth. This is episode 314 of the podcast. We are recording in March of 2025 in case you are watching or listening in the future. This week on The Anxious Truth, we're going to talk about the difference between acceptance-based strategies and control/management-based strategies when we're dealing with chronic and disordered states of anxiety. So stick around for that. If you're new to The Anxious Truth, this is the podcast where we talk about all things anxiety, anxiety disorders, and anxiety recovery. I am Drew Linsalata, creator and host of this fine podcast, or I hope it's a fine podcast, or this YouTube channel, depending on where you're consuming. I am, as of March of 2025, a pre-licensed therapist practicing under clinical supervision, specializing in the treatment of anxiety and anxiety disorders. I'm a 3-time author on this topic. I am a podcaster, not only hosting The Anxious Truth, but also co-hosting Disordered with my buddy, Josh Fletcher. I am a past sufferer of these very same problems that I talk about for many, many years of my life, but much better now, completely recovered for many, many years now as well. Psychoeducator and advocate, social media guy. And I am going to try to help as best I can within a one-to-many helping model of either a podcast episode or a YouTube video. If you're new to The Anxious Truth and you just stumbled upon us today, I hope you find what you find here helpful or useful or applicable in some way. And of course, if you're a returning listener or viewer, thanks. I appreciate you stopping by and hanging out for another 20 minutes or so, whatever we're going to do today. So we're going to talk about the difference between acceptance and control strategies when you're dealing with anxiety and anxiety disorders, chronic and disordered states of anxiety, which I have to remind you just quickly is a little bit different than just I have anxiety, right? We talk about I have anxiety all the time. Everybody talks about it. It's all over the place. We're talking about internally generated states of anxiety. There's a difference between I'm really anxious because my boss is stressing me out, or I'm really anxious because I have final exams coming up. I'm really anxious because my neighbor and I are in a conflict. That's one type of anxiety. Here on The Anxious Truth, we're always talking about the internally generated anxiety that results from being anxious about being anxious. It doesn't matter why you're anxious. You only care that you're anxious. The anxiety itself becomes the most important thing. The scary thoughts, the sense of distress, the discomfort, that's what we're talking about here. So we call that disordered anxiety. Some people might call it chronic anxiety, and that's what we're addressing. When you're in this situation where you feel like you're uncontrollably anxious all the time for a variety of reasons, that might mean panic attacks, which lead to agoraphobia. It could be generalized anxiety disorder, constant persistent states of overthinking and ruminating and worrying. It could be OCD. It could be health anxiety. There's a million different ways we can get to this chronic or disordered place. But when you're struggling with that, the most common way to try to address that, and if you spend a lot of time scrolling around on YouTube or listening to podcasts or doing the endless scroll on platforms like Instagram or TikTok, you're going to see a lot of people advocating for control and management-based strategies. So when you hear things like regulating your nervous system regulation, vagus nerve activation, managing triggers, avoiding triggers, techniques for instantly calming down, count the things that you can hear, see, smell, touch, count 4 blue things in the room, tap on your cheek, get an ice pack, jam your face in a bucket of ice, put your feet in the grass, breathe this special way. This is a one way to end panic attacks forever, or instantly calm down, or these are ways to like eliminate anxiety forever. You are being taught about control and management-based strategies. Now, that makes common sense, because if you are an externally sort of normally anxious person and you understand that you are anxious because of something that's happening that's stressing you from outside your skin, well, yeah, those might be good stress management and anxiety management techniques that we can use to help you like deal with it and move through it a little more so you can stay focused on solving the problem at hand, or getting safe, or getting out of the stressful situation, or whatever it happens to be. But when we are in a chronically or disordered state of anxiety, when you cannot get away from your own internal experiences like bodily sensations and scary thoughts, especially when those are being triggered by a fear response and your body and mind are just doing what it's designed to do, trying to control and manage that experience by acting directly on symptoms and thoughts and trying to use interventions or techniques or hacks or tricks designed to prevent the triggering of anxiety or instantly fix it manipulate it, control it, or stop it when you do get uncomfortable tends to be counterproductive. And while you might find some strategies that are helpful on the short term, sometimes you will also probably find that they don't help on the long term. And even if you can find some coping strategies that are based on control and management that can get you through anxious moments, you have to keep using them again and again and again. And you may wind up in a situation where you're wondering, I don't understand why I'm still afraid to panic. I don't understand why I still have OCD. I don't understand why I'm still so worried and ruminate about my health all the time. So we have to look at the application of control and management strategies in the case of chronic and disordered anxiety, and maybe give it the side eye a little bit, because those things tend not to work. Now, what we're talking about, and what you hear people like me talk about all the time, people who specialize in the treatment of chronic and disordered anxiety, we are relying on evidence-based, and I say evidence-based not to be a snob or a science snob, but these types of treatments or approaches to chronic and disordered anxiety that are based on things like acceptance and mindfulness have far better consistent outcomes for the people who employ acceptance and mindfulness based strategies, as opposed to people who rely on avoidance, control, or management based strategies. We just have too much data over many, many years that shows us that. Now, acceptance and mindfulness is really those are sort of the hallmarks of the most current forms of most effective empirically validated treatments for anxiety disordered or chronic anxiety disorders or chronic anxiety, but they have been baked into things like cognitive behavioral therapy for a long time. Just that in the past, even cognitive behavioral therapies were a little bit control-esque, if you will. Let's show you that your thoughts are irrational and then you can change them, which, as it turns out, doesn't really work all that well also. And that was a little bit too control heavy and wound up with a lot of high relapse rates, and people had a hard time maintaining a level of recovery that they found through trying to control their thoughts or instantly change their thoughts or change their beliefs just because they know that the old beliefs are irrational, right? So we are really looking toward acceptance and mindfulness-based strategies as the most effective ways to deal with these things. This is a hard sell because it is very difficult to convince somebody who is incredibly uncomfortable, afraid, or feeling distressed and feeling a little bit worn down and hopeless by that the way out of that is to learn to accept the situation. We are never talking about, this is where it's really important to understand the difference between internally and externally generated anxiety. If it's an external threat, we do not accept external threats. And a threat can be defined in a lot of different ways. If you are getting stressed out over things that you simply cannot change in the world, but that don't pose an immediate threat to you, well, now we have like a generalized anxiety disorder kind of thing, or we have that overthinking, overplanning, sort of control freak thing. We all understand the term control freak. But if you are trying to control things that you actually can, in fact, interact with that are making your life worse and stressing you out, then that's a good plan, right? So the issue here is when we're trying to apply control and management in situations where they were never meant to be applied. Control and management in the context of our internal experiences like thoughts or emotions or beliefs or ideas, or even physical sensations, which I know we don't always include physical sensations technically in the realm of internal experiences, but it's important to recognize that when we're trying to apply control and management approaches to things inside of us that were simply not designed to be controlled or managed or manually operated, your nervous system doesn't actually have levers and knobs that you can manually operate. I don't care what your favorite podcast biohacker tells you is true. That simply doesn't appear to work at least in our population. When we try to apply management and control strategies, things tend to go off the rails, they backfire, and then you can wind up feeling really frustrated. When we talk about accepting, remember, since it's an internal state that we fear or we find so uncomfortable, but internal states are not dangerous. When we talk about acceptance, what we're learning to accept or deal with and navigate through or respond to more productively is a state where we are very uncomfortable or maybe really afraid, but we are not in any actual danger. There really is no threat that we're trying to protect ourselves from or get away from. The perceived threat comes from inside us. And while that can be every bit as uncomfortable, scary, and triggering, no doubt about that, we have to acknowledge the fact that we're not asking anybody to use acceptance-based strategies in the course of chronic and disordered anxiety to accept an actual threat or accept actual danger. It just feels like you're trying to accept a dangerous situation, but feeling like and reality are not always matched, as anybody who listens to this podcast can personally attest. It's part of the thing that maintains that chronic or disordered state. So we are looking for acceptance-based strategies, which start from the premise that what my body and mind does are not necessarily designed to be manually operated, controlled, or managed by me. There are physiological processes, there are societal norms, there's acculturation, there's all kinds of stuff going on. There's just biology, there's neurobiology, there's all of the things that got us to this point, and us, I mean, all of us as human beings combine to make humans susceptible to respond to what they think is a threat in certain ways. When there's no threat, that threat comes out of order. There's a threat detected before there is actually danger. That's why we call these disorders, because they're out of order. And we wind up becoming afraid of our own bodies and minds. And then we hope that we can try to somehow find a way to control our bodies and minds, but we didn't evolve to be able to do that. So we have to learn to say, well, this is actually happening right now. I do suffer from chronic or disordered anxiety. I have developed a fear of my own bodily sensations or my own thoughts or my own emotions. And what am I going to do with that now? I could try to control that and bend it to my will and stop it from happening and hack my nervous system and learn to regulate and rub my ear or my neck and try to activate my vagus nerve. And it's not really working for me. Or I'm going to have to be okay with the idea that this is in fact the situation that I find myself in. And now I have to work on learning to respond to this in a different way so that I can learn through experience that I don't have to fear my own body and mind. Those states are certainly uncomfortable or even downright terrifying at times. Not trying to counter that. That is 100% true. That subjective experience is very disturbing. However, we can in fact learn that if we don't stop everything dead in its tracks to try to directly operate on how we feel to make it change or stop it or go away, well, we learn that even if we don't do that, we come at the other end of these experiences. And while it may take a lot of repetition and patience and time to learn those lessons, you are actually learning over time and teaching the lower part of your brain responsible for managing that threat detection and response system that it's okay to be anxious. It's okay to even panic. It's okay to have scary thoughts that may be related to OCD or generalized anxiety disorder or specific health concerns. All of those things are okay. I don't have to stop everything, manage them, stop them, make it go away, force myself to calm down in order to be okay. If I actually learn to do nothing, but accept that this is a very uncomfortable situation that I'm in, because my brain is sort of stuck in a loop where it keeps looking for threats, and then it creates the very threats it's looking for. If I don't accept that situation and begin to approach it in a different way, meaning instead of fighting it, I learn to work with it and through it. And that involves challenging sometimes some very long-standing beliefs that no, you don't understand. It's impossible. If I panic, I have to go to the ER. I have to get an ice pack. Okay. Well, those are control and management strategies, whereas an acceptance-based strategy would suggest that you actually don't have to do that and you will still wind up okay. So in an acceptance or mindfulness-based strategy, those things really come together. I've talked about mindfulness a lot lately. But in an acceptance-based strategy, we are not trying to manage, control, turn off the feelings, hack the feelings, trick the feelings, do 3 simple things that instantly calm you down or stop you from being anxious. We cannot just decide to not be anxious. We can't choose positivity techniques to just feel happy even though we're terrified. We can't do any of those things. We have to let what happens so that we can get better at having those experiences. And when we discover that we are competent in the area of handling our own internal experiences, even the scary ones that we hate, well, then they aren't so scary anymore over time and things change. If I don't have to be afraid of my own body and mind, then I don't have to worry so much about trying to manage those things to keep them from doing things that I don't like. Now, I said in the very opening of this episode that you don't have to take, where are we? I don't know how long I've been going. I'm going to try and keep this under 20 minutes. You don't have to take my word for it. I said, your peers tend to agree. Where does this come from? I asked my Instagram audience, there's about 91,000 people following me on Instagram. I asked my Instagram audience, tell me what the most valuable principles of anxiety recovery are for you. And overwhelmingly, the responses were acceptance-based. There was a few people kind of doing the control thing, which is totally understandable. And by the way, you always have autonomy. You can pick whatever strategy you think is right for you. I might not necessarily agree that it's the most effective way to approach it, but if you think that control and management is the best way for you and avoidance counts as control and management, then I would support you on that. You get to make that choice. You won't get a lot of, information on my channel or my podcast that supports that sort of thing, but I do support your ability or your right to choose that path for sure. And I respect that. So while a very few of the responses were a little bit control based, and usually those indicate newer listeners or newer followers on the social platforms who are just becoming familiar with this type of approach. And it's totally fine. If it seems ridiculous to you because you've never heard it before, it may take you quite a long time to get to the point where it's like, maybe there's something to that. It's okay if you want to dismiss this out of hand because it seems ridiculous. Pretty much everybody thinks that the first time. So it's okay. The vast majority of responses not only pointed at a shift to acceptance-based strategies. We use terms like willful tolerance or floating or surrendering or like working through, allowing, not fighting, dropping resistance, learning that I can handle these things. The responses were just over and over the same responses. But to me, the most important thing was the vast number of people in this response set. And by the way, this isn't scientific. It's a big audience, but there's nothing scientific about the sampling, just full disclosure on that. The vast majority of people also took note of the fact that they had to shift toward acceptance. So there were many, many responses to my question that included phrases like, I had to learn, or coming to realize that, or finally believing that it was okay to have a scary thought. So many people in this response said, while they will echo in their own real personal experiences, it's not just me talking, this is actually anxious people who are working on this particular issue and trying to overcome it. They are echoing the fact that, whoa, acceptance-based strategies really are working better for me. Most important for me in this response set was that they had to learn that. They had to embrace that finally. They had to come to that conclusion. They had to give it a shot. Some people were forced to do it because for whatever reason, they started panicking in circumstances where they couldn't run away or couldn't get their safe person. And they were forced to learn that, like, wow, if I just had to let it play out, it would play out and I would be okay anyway. So it's not just me. It's not just the therapists. It's not just the researchers. It's not just those of us who have this theoretical orientation. Actual anxious people, and I will include myself in that set because I used to be in the same boat that you are probably in today. I got out of it using acceptance and mindfulness-based strategies. Now, when I was doing the heavy lifting in my recovery, I didn't know that's what I was doing. I know I was using acceptance. I didn't really understand that I was using principles of mindfulness, but I used mindfulness and acceptance-based strategies to learn to work through my most triggered circumstances that I used to be terrified of. Now they don't scare me anymore. So I frankly don't care whether I panic or not. I had that personal experience. It aligns with my theoretical orientation as a clinician and a mental health professional, but actual anxious people going through this process, just like you are right now, seem to echo like, yeah, when I do give that a shot, acceptance-based strategies a shot, and I kind of turn away from the control and management stuff, things do begin to change. Is this the biggest part of the community, which I'm starting to hate that word, but the community of anxious people? No, it's not. Most people are still going to kind of follow along with the control and management based strategies. And I understand why, because it would seem to offer immediate relief or instant relief when you feel like it's urgent and you got to feel better right this second. I get that. Somebody who tells you to get an ice pack or tap on your cheek or activate your vagus nerve is offering you some form of possibly immediate relief from a very scary circumstance. So I totally don't blame anybody for going down that road. And social media platforms, it's certainly a lot easier to get likes when you teach people how to calm down than it is trying to teach people to try not to calm down and learn from that. So I get it. You might be looking around and say, yeah, but how come all these giant accounts keep talking about ice packs and 5, 4, 3, 2, 1 and box breathing and this technique and that technique? Well, because it's certainly a lot easier sell and it's easier to get algorithmic traction on public platforms advocating for control and management strategies. But when we look at the most empirically validated actual real world treatments for chronic and disordered anxiety, things like the third wave CBT treatments, acceptance and commitment therapy, MCT, that sort of stuff, you're going to see acceptance and mindfulness. You're not going to see control. In fact, if you have OCD and you're going through exposure and response prevention, which is the gold standard treatment for OCD right now, forgive me, ICBT folks, I know you're working on it, but if you're going through ERP therapy for OCD, and by the way, all exposure is exposure and response prevention, not just for OCD. One of the most interesting things for clinicians to see when they learn how to do ERP is that at no point during that response prevention do we teach calming interventions. We don't do it. We have to, the person has to learn that even when they're triggered, if they kind of don't do anything, that experience is going to rise and fall naturally because that's the way it happens. So even therapists have a hard time understanding if they don't decide to specialize in this thing that I specialize in. And by the way, I'm not better than them. This is just my specialization. That's all. So even people who don't specialize in this, who are, well-intentioned, kind-hearted, wanting to help mental health professionals, have a hard time understanding that, like, wait, when do I teach the person how to calm down? Well, we don't teach them. They have to learn that even if they don't forcibly try to like turn the knobs and pull the levers on their nervous systems and their emotions and their thoughts, they wind up okay anyway. So when you get into the most empirically validated, like proven effective, and I say proven effective as they have the best outcomes when looked at on a large scale with the least or the lowest relapse rates and return to treatment, because people relapse, these are acceptance-based strategies. So again, we see it in ACT, we see it in MCT, we see it in all the third wave therapies. They're really effective. And unfortunately, they are hard sell. But that is exactly why I talk about them, because they work. And when you are listening to this podcast or watching this YouTube channel or following me on social media, you keep hearing this acceptance-based strategy again and again and again. That's why people like me will talk about that, but also your peers that have adopted this strategy will in fact confirm by and large, like I have a much better chance of a positive long-term outcome if I stop trying to control, manage, and avoid, and I go down the acceptance route. All right. So that is probably, and I'm, you guys are going to laugh if you follow along at all. I'm not the one simple trick to end anxiety forever, but I am going to suggest, and I've said this before on this YouTube channel or this podcast, that if you can try and put your brain around one concept just to get the ball rolling and start to change your circumstances and move toward the change that you're hoping for, it would be to at least consider that maybe trying to control or manage your body and your mind and your emotions and your nervous system, things that tend to fall outside of our control because they were not designed to be controlled. Maybe, is it at least possible that that's not the best way to do this? And while it might be the way that you want to go, if you're looking for immediate relief every time you're triggered, on the long term, if you're feeling frustrated because you can't seem to make any progress, well, know that your peers, other anxious people, are they themselves talking about how acceptance-based strategies really started to change things for them and help them move forward in the recovery process. So it's not just me. It's not just the guy with the camera and the microphone. It's not just a therapist like the guy with the camera and the microphone. It's actual anxious people who begin to confirm this if you ask them. You would have to go into, again, communities. We're going to talk about that word very soon because there's a lot of stuff that's starting to bother me about that word, and we'll get there. But if you go into communities around this podcast, The Anxious Truth, or Disordered, that I host with Josh Fletcher, you can find that at disordered.fm. If you look at people who are engaged in certain online recovery programs like DARE, Michelle and Aida are great therapists that run the DARE program. They are an acceptance and mindfulness-based program. Like anybody who's involved in the acceptance and mindfulness stuff, anybody who's following the work of Dr. Claire Weeks online, where those people congregate, the stories you will hear are, boy, it's really hard to do this because I have to be brave and allow these really uncomfortable experiences. But once I do learn how to do that, things actually do start to improve. So if you're still trying to hang on to like, please tell me a way to prevent my panic attacks or instantly stop them when they happen, for instance, you might consider like, well, maybe I have to look for alternative strategies here. And those alternative strategies would be acceptance and mindfulness based. And if you look into communities or online gatherings of people who are using those approaches, you will start to understand like, oh, wait, these people are actually starting to make some progress, it would appear. Although they will always acknowledge, and I will always acknowledge, it's hard to accept things that we don't like and not instantly fight against them, right? So that is probably the number one thing that you really have to think about. I have to pick between going toward control and management or going toward acceptance and navigation in a mindful way. One gives me a better chance of a long-term outcome according to the data and according to real world experience. I have to learn over time that it's okay to be triggered. It's okay to be anxious. It's okay to have scary thoughts. I don't have to manually operate them and fix them to be okay. Or the other side is I have to learn how to calm down anytime I don't feel good. And I can do that, but it feels like I have to keep doing that. And then that's just like a lifelong coping strategy that tends to get in the way. So again, everybody gets to pick whatever path they want to take. There's nothing wrong with that, but at least consider that it's not just me. Your peers will tell you that acceptance-based strategies seem to have a better chance at producing a positive outcome and producing a life closer to the one that you would rather be living than an anxious life, right? So important. This is the thing. I will close with one other sort of concept when it comes to acceptance versus control and management. It will be tempting very often, and many people wind up a little bit stuck in this no man's land, to say, oh yeah, okay, cool. This guy seems to know what he's talking about. Or like, yeah, when I do the research, like there's a ton of data that seems to support what this dude is saying. Cool. And I'm going to try to do acceptance. We could talk about that some other day because it's not a thing we do. But all right, I'm going to try and drop all my resistance and try to accept my anxiety. But I'm also going to try to do that while I'm still tapping on my cheekbones and carrying ice packs around and always knowing who my safe person is. The tough thing about that is you almost can't do both of those things. We're either allowing or we're not allowing. We are either dropping our resistance or we are still resisting. If you find that you're in that middle ground where like, yes, I get it. I hear you, Drew. I hear you, Josh. I hear you, Kim. I hear you, Claire Weeks. You know, Dr. Weeks, unfortunately, has passed for many years now, but whoever, Russ Harris, Stephen Hayes, I hear you, all of the, you know, these acceptance people. I'm doing that, but I'm also trying to manage my symptoms and manage my thoughts and calm myself down with special techniques and not be triggered because I do these special health techniques that are meant to keep me calm and regulate my nervous system. There can be some stagnation because those are in fact control and management strategies, which are really in the end avoidance strategies. So if you're trying to accept your anxiety and learn that you can in fact handle being really anxious and uncomfortable because of your internal state, but at the same time, you're trying to manually operate your internal state to try to not feel it or turn it down instantly. Well, what are we actually learning? So sometimes we wind up with competing objectives when we try to put together acceptance and management-based strategies. They don't tend to fit together all that well. Again, that's not an indictment of your choice to use management or control strategies or avoidance strategies. You get to pick those. There's nothing wrong with that. I wouldn't judge you negatively for that, but just know that it's really difficult to try and put these two things together. You almost got to pick one or the other. So that is episode 314 of The Anxious Truth, wrapping it up, a discussion of acceptance being, I think, a better choice or superior choice than management and control, why that is, what the data shows us, and how, you know, groups of your peers, when asked, will sort of validate this, just that it's a hard sell to want to go down the acceptance route. And I get that. So I hope you have found it helpful in some way, shape, or form. I'll come back again in 2 weeks with another podcast episode. I'm not really sure what I'm going to talk about, but I will. I'm actually thinking of doing a driving anxiety episode. So if you want to use the link in the podcast description to send me a text message to say yay or nay on driving anxiety or the YouTube comments, I will listen. I promise. I think driving anxiety, talking about specifically like what does exposure look like for driving anxiety? I might do that episode, but that'll be in 2 weeks. We'll see. I'll do that one. If I don't do it in 2 weeks, I'll do it at some point. If you're listening to the podcast on a platform that lets you rate or review the podcast and you really like what you're hearing here, leave a 5-star rating because it helps the podcast get discovered by more people. And if you really, really like it, maybe write a quick review that says why you like it, because that helps even more people find the podcast, which helps them get the help that they hopefully need or, you know, kind of go in the right direction, which is why I do this to begin with. There are more goodies on my website at theanxioustruth.com. So you don't have to stop with just this YouTube channel or just this podcast. Go over to my website and check out what else is there. And what else can I tell you? Just remember, no matter what step you take today that moves you away from retreat and toward moving through your fears, even if it's the tiniest little change, dropping a tiny little safety behavior or doing one little thing that you thought you surely couldn't do, anytime you take that step, it actually counts as long as you can learn something from that experience and take it with you into the next experience. There are no wrong experiences in anxiety recovery, only wins or learning experiences. Try to hang on to that. Be nice to yourself. When you want to criticize yourself for failing or being too weak, none of that is true. Hang in there, one moment at a time, one experience at a time. You could get there. If I didn't think you could, I wouldn't be doing this. Thanks for hanging out, and I will see you, I guess, online, or I'll see you in 2 weeks. Take care.